What is this? Can you name? Can you name the parts? Why? Huh? now. This is Sphygmomanometer, right? What is this? Cuff. So you have to know first the parts. Okay. So what is the name of this? This is a cuff or non-distensible cloth. Okay. This is made up of non-distensible cloth. Means what? Yes, it cannot be stretched. Okay. And inside the cuff there is a bag. Okay. If you can see, there is a bag. Okay. The measurement is, okay, it is in adult it is around 23.5 the length, and the breadth is around 12, okay, centimeters, okay, for adults. Okay, so this is the measurement. Okay, from here to here is the length, and from here to here is the breadth. Okay, so this is, the bag is made up of non-distensible cloth. Okay, this is non-distensible cloth. Okay, this is the cuff, and the bag, it is made up of flat, not no, it is inflatable. Okay, the bag can be inflated, but this is not distensible. Okay, so it this way it balances the pressure. Okay, this will be inflated, and this will be non-distensible. Okay, so it is flat, non-inflatable, inflatable rubber bag. Okay, it is inside the cuff. Okay, understood? Okay, so there are two tubes again. Okay, one is connected with the hand bulb. Okay, bulb. Okay, and this is valve, valve. Okay, this one. Okay, this is used to lock the air pressure. Okay, when you will be inflating it, okay, that time you have to press it right now, like this. You have to press it, and if you lock it, it will get inflated, but it won't deflate. Okay, when you release the valve, that time the pressure will be decreased. Okay, this is the function of this valve. Okay, this is connected with the rubber bag, and then with this tube it is connected with the other tubings. Okay, this tube, this is connected with the, this is what? This is mercury reservoir. Okay, and again this is connected with the, this is what? This is a lock. Okay, this is off and this is on. Okay, this is when it is longitudinal, this is off, and when it is horizontal, it is on. Okay, so now if I press the valve, it will rise, isn't it? And what is this? This is a manometer. Okay, there are graduations, you can see. Okay, and the distance between each small graduation, it is 2 mmHg, 2 mm of mercury. Okay, and it is, the lowest point is 0 and the highest is how much? 300. Okay, so when you will be placing the cuff on the arm of a patient or a person, okay, when you will be pressing it and giving the pressure, the bag will be inflated. Okay, and then the pressure will correspond with the mercury. Okay, so what is the principle of measurement of BP? It is balancing of the air pressure between the cuff or the bag, okay, the rubber bag, and the column of blood in the artery. Okay, this is the principle. Okay, then, and what is the method here we are using? There are two types of method. What is direct, where we place the cannula inside the artery. Okay, directly the pressure is measured from the artery. Okay, the column of blood, you know the definition, the column of blood which is putting the pressure on the arterial wall. Okay, so directly when we put it inside the artery, that is direct method. So this is what? Indirect method. Okay, and this is gold standard. Okay, because why? Because here we are taking the help of the mercury. Okay, and this is gold standard because if we go to higher altitudes or at the sea level, okay, the pressure doesn't changes. That is why mercury sphygmomanometer is gold standard. Okay, there are other types of sphygmomanometers like digital and aneroid. Okay, this is the aneroid. Okay, where we directly take the BP. Okay, using this same. This is the hand valve. Okay, BULB. Okay, this is the valve VALVE. This is the non-distensible cuff. Okay, this is also known as Riva-Rossi cuff. Riva-Rossi, RIVA, Riva-Rossi cuff. Okay, Riva-Rossi cuff. This is non-distensible. Okay, and inside it there is a rubber bag. It is flat, inflatable rubber bag. Okay. So this is like you have seen envelopes, na? Given is to submit some invitation or something. Okay, there is an envelope. So this is an envelope. Okay, covering the rubber bag. Okay. Same way, this is the dial. Okay, with the graduations. Okay. You have seen the digital. So there are. This one is the mercury, this is the aneroid, and other one is the digital. Okay, 3 types. Okay, so you have to know, as you said, the systolic BP. So what is the normal systolic BP? 120. Okay, so there is a range. Okay, that is 100 to 120 or 130 mmHg, and this is the systolic. Okay, whatever diastolic, it is 75 to 80. Okay, mmHg. So what is pulse pressure?
75 between systolic and diastolic.
What is? Huh?
Difference between systolic and diastolic.
Okay. So this is around how much?
126 by 80.
This is around 40 mmHg. Okay, the difference. Okay. What is mean arterial BP? Mean arterial BP. That is diastolic. That is diastolic minus 1/3 of pulse pressure. Okay, there is a formula. Okay, it is around 95 to 100 mmHg. Okay, the normal range. Okay, so these are the ranges. Okay, so you know now the parts. Okay, so you should know also the criteria or the procedures how to measure a BP. So how will you measure a BP? Have you ever measured? Have you ever seen someone? Okay, how? Okay, first let us know something about the cuff. Okay. So this cuff, as I told, the measurement is 23.5. This is the length. What is the breadth? 12 centimeters. Okay, this is for adults. Okay, so the ranges of the cuff, the measurement, suppose in case of less than 1 year of age, okay, it is around 2.5 centimeters. Then in case of 1 to 4 years, it is 5 centimeters, and in case of 8 years, it is around 8 centimeters. Okay, in adult it is 23 to 12.5 centimeters. Okay, again, till 1 year it is 2.5 centimeters. Till 4 years it is 5 centimeters. Okay. Till 8 years it is 8 centimeters. Okay. So this is the range. So one is peripheral resistance or tissue resistance. Okay. So to overcome this tissue resistance, some modifications has been done. Okay, in the cuff. Okay. So So it must be, the cuff must be covering the arm circumference, and it must be 20% wider than the arm circumference. Okay, and the length, it must be more than how much? 2/3. Okay, it must be at least 2/3. Okay, of the arm circumference. Length is which one? It must cover, okay, 2/3 of the arm. Okay, and what about the width? It must be 20% more than that of the arm circumference. Okay, so this is the modification, okay, to overcome the tissue resistance. Okay, so now we'll go to the procedure. Okay, so what about the procedure? So first we have to, so there are two procedures. You can measure the BP of a patient or a person either in lying down condition or in sitting position. Okay, in supine position or in sitting position. Okay, so who want to be the subject? Want to be the subject? Okay. Sitting. You keep the book. You get up. Put your arms, legs above in the bed. So before measuring the BP of the patient, he or she must rest for at least 5 minutes. Okay. So he or she must rest for 5 minutes. Okay. Then this BP machine should be at the level of the heart. Okay, it should be at the level of the, suppose this much. Okay, so someone hold it. Okay, so this should be at the level of the heart. Okay, what will happen if I keep the machine below the level of the heart?
Pressure.
Why?
Because gravity.
No, gravity. Because the effect of the gravity, the BP will be more. It will give excess, okay, result. And what will happen if the machine is above? Low. Okay, same due to the effect of the gravity. Okay. So first of all, there must be no clothing present. Okay, between the cuff and the arm of the patient or the skin of the patient. Okay. So and this cloth shouldn't be above. You shouldn't fold it like this. What will happen?
The pressure will be of upper side.
What will happen?
The diameter will increase.
Diameter.
Some sort of pressure will be exerted on the upper part.
So it will
No.
the pressure.
Reduce the
I am talking about this cloth. You shouldn't fold it like this. Why?
It will tighten up the
Tighten up. Yes. It will
Pressure.
give more pressure, na? It will give more pressure. Okay. What is the position of the cup? Okay. This arm should be pronated, and this wrist should be a bit flexed like this. Okay. And what should be the? Okay, this was not true. Okay, where should be the position of the cuff?
in a way that it's
above.
Okay, can you open your apron? Above the?
the tube should be facing medially.
Elbow.
Okay, about not about. Okay, tube you are telling, but what should be the cuff? Where should be it placed? Huh? It should be. This is, we told you, we have told you, na, this the palpation of the brachial artery. Okay. So where should we palpate?
Medially.
Between the biceps and triceps.
Biceps and triceps.
Cuboid.
Yes, this is the cubital fossa, above the cubital fossa, na, antecubital fossa. Okay, and it should be medially to the tendon of the biceps and the middle malleolus. Okay, that position we have to palpate the radial artery, brachial artery, right? So if the cuff is placed above the cubital fossa in the antecubital position, then only we can palpate, na, or auscultate the artery. If we put down, we cannot palpate, na. or auscultate. Okay, it is not exposed. The artery is not exposed properly. Okay, so this clothing shouldn't be present. Okay, now we have placed it above the antecubital fossa, and this tube should be medially and directed where? Inferiorly. Okay, in one book it is written inferiorly, and in another book it is written anterolaterally. Okay, so I am putting it medially and inferiorly, inferior direction. Okay, in occasion it is written inferiorly. Okay, and this cuff should be not too tight, not too loose, not too tight, not too loose. Okay, how will you understand it is too tight or too loose?
Ask the
In
question.
such a way that it doesn't slip off.
No, at least 2 fingers should be going inside. See, it's freely going inside. So this is not too tight, not too loose. Okay, okay, fine. Now, okay, so it is almost 5 minutes. Okay, so now she is in sitting position. Okay, you have to also see that the patient is like not in anxiety, not taking any medication. Okay, like any coffee, tea. Okay, which can increase the BP. Okay, so if she said that she has taken some medication, okay, and she has some anxiety issue, at least 30 minutes should be given to her before measuring the BP. Okay, so now we have placed the cuff in position. Okay, cuff above the antecubital fossa, and the tubes are medially and inferiorly, directed inferiorly. Okay, now, and her arm should be pronated and wrist should be flexed. Okay, so now we have relaxed her arm, and we have exposed the artery. Okay, so now there are 2 methods of measuring the BP. Okay, first is the palpatory method. Okay, can you open your watch? First is the palpatory method. Okay, palpatory method, as you have checked it now, the radial pulse. Okay, as we have checked it earlier, the radial pulse. So this method we will be using now. Okay, so now this is at the level of the heart, and now we are tightening the valve. Okay, and now I am feeling her radial pulse. Okay, it is palpating. Okay, now we will slowly inflate the valve. Okay, so now after increasing the pressure to a certain extent, at certain moment the pulse will disappear. That means what? The artery is blocked, the blood flow has been blocked. Okay, so suppose I am not getting heart pulse around 150 mmHg. Okay, now I will slowly deflate. Okay, the deflation rate should be 1 to 2 mm per second. 1 to 2 mm per second. Okay, this needs practice. Okay, see, it is going so fast. Means very slow, na? Per second you should drop, na, little by the mercuric level. So around 96 mmHg I am getting her systolic BP. Okay, so this is the palpatory method. Okay, so what is the advantage of palpatory method? An advantage,
Accurate systolic pressure.
Accurate systolic pressure.
So when you don't have to connect the stethoscope.
Okay. So what is the advantage? So this helps us. Suppose in certain patient you might get a BP which is very much higher. Okay. Suppose you have raised till suppose 200 mmHg and the patient is hypertensive. Okay. Suppose his BP is 280. So you have raised till 200. So when you'll be starting from the 200, you will be getting the beat na, and at certain point you will if you measure through auscultatory, okay, at certain point the beat will diminish or be silent, right? So if you palpate, if you use this palpatory method, so the first beat or the palpation which you are getting at the highest level, you can measure, you can get the idea. So it helps during measurement of auscultatory method. Okay. And what is the disadvantage?
Only the systolic.
Only the systolic, and the systolic is very much, at least I think 10 to 15, okay, or 10 to 12 mmHg less than that of the palpatory. The auscultatory, the diagnostic is auscultatory, okay, but in palpatory it is a bit higher. It shows a bit 10 to 15 mm above the systolic BP. Understood? It is a bit higher. Which one?
Can you repeat it again? The disadvantage part.
Disadvantage. Advantage I told, it will help you. Suppose the patient is hypertensive, okay, and the patient's BP is around, suppose take 280, okay. Suppose you have inflated the cuff till 200 or 250, okay. So you will be getting the beat, the sounds, various sounds. I will be coming to that, okay. How does the sound feels, okay. The various phases. So suppose you thought his BP is 250, but when it will be going down, suppose his diastole came around 140, okay, but actually it is not. It is much more higher, okay. The maximum it is 300. So for every patient you cannot go to till 300, na, isn't it? So this is helping us indirectly, okay. First you have to go for palpatory method, then the auscultatory method, okay. This is the advantage. What about disadvantage? One, who told? Diastolic pressure cannot be measured, okay, with the palpatory method. And the other is
Palpatory method, the pressure is slightly
higher than that of the systole, the original or the actual systolic BP. Okay, it is around 10 to 15 mmHg higher than that of the systolic BP. Okay, understood? Okay. So this is the auscultatory. Sorry, now this is the palpatory, and now we'll go to the auscultatory. So before starting the inflating the cuff, okay, with this valve, you have to ensure that the mercury reading, okay, this mercury reading is at 0. Okay, you can see the 0. This is the 0. See whether it is in 0 or not. It shouldn't be up above the 0 mmHg or below the 0 mmHg. Okay, it should be exactly at the 0 mmHg. Okay, before starting, and you have to also see after it ends. Okay, this is to avoid the errors. Okay, so can you again please hold it? Okay, so now we'll go to auscultatory. So her BP was 96 mmHg by palpatory, right? Similar way. So now we have the idea that our BP is around 96. Okay. So now with the help of the palpatory, we'll go for the auscultatory. Okay. Okay. And the level of the heart. Okay. Now what is the parts of this? A quick revision. This is the earpiece of the ear knobs. This is the metallic tube. This is the Y-shaped tube. And the rubber tube. This is the chest piece. This is the
The whole thing is just
yes. This is the diaphragm. This is the bell. Okay, fine. So now this should be, what is the direction of the ear knobs? Forward and middle, right? And you should see whether it is on or off. Okay, this is now off. one clicking sound will be heard. Okay, now it is on. Fine. So now we know her palpatory BP. This is around 97, right? Or 96. 96. Fine. So now we will measure her auscultatory. Okay, same way. It is at 0. Okay. So now I am gradually raising it. What should be the deflating speed?
1 to 2 mmHg
Per
second.
Is my speed okay? Huh? Keep it here. So here it came around 110 by 80. Okay. So this is the auscultatory method. Okay. So when you will be getting the when you will be inflating the cuff, okay, at certain point at the lowest most point there will be silence first. Okay, when you start from 0. Okay, at certain point you will get the beat. Okay. Again after a certain point the beat will be diminished or absent, or there will be complete silence. Okay, so when I increased her BP, okay, when I inflated it till 150, okay, after till 150 I have inflated it, then I have decreased it or deflated it at the rate of 1 to 2 mmHg per second. Okay, so at 110, okay, at around 110 I got the our first sound. Okay, so the first sound is the systolic. Okay, so there are various phases. So what are the phases and what are
There won't be beats.
what are the phases and what are the sounds?
The first sound is due to ejection. Closure of AV valve.
How are the sounds? How are the sounds heard? Can you describe the sounds? Is it?
The first sound is the love.
Okay, the first phase, okay, the first phase it is 10 to 14 mmHg, okay, the space, okay, it will be heard around 10 to 14 mmHg, you will get the first phase, okay, it is faint, clear and tapping sound, faint, clear and tapping sound, okay. The next phase is starts from 15 to 20 mmHg, okay. It is a bit more than that of the first phase. Okay, it is how the sound will be heard. It is murmuring or musical sound. Okay, this is from 15 to 20 mmHg. Okay, this is the phase 2. Then comes the third phase. Okay, third phase will be loud and clear. Loud and clear. Okay, this is the third phase. Okay, this is around 5 to 7 mmHg. Okay, the last phase is fourth phase. Okay, this is muffled and dull. Okay, you remember the sound dull? This is muffled or dull sound. Okay, this is around 5 to 6 mmHg. Okay, and then the sound will disappear. Okay, so can you revise it?
First phase is faint, clear and tapping sound. The second phase is the
First one is
10 to 14 to 14.
How is the sound?
Faint, clear, and tapping sound.
Faint, clear, and tapping sound. Okay. Then
Second is
15 to 20 mm.
The third is loud and clear, which is 5 to 7 mm.
5 to 7 Hg.
The fourth phase is muffled
to 6
and
Muffled or
dull.
dull. Okay. This is 5 to 6 mm. So this is the various sound you will be hearing when you will come from the systole. Okay. Phase 1, 2, 3, and 4. Okay. Above phase 1, the sound is diminished or silence is there. Okay. Silence you will be hearing. Okay. These are the 4 phases, and the last sound which you will be hearing when the sound just disappears. This is the first sound which you hear. This one was the systole. The last sound when the sound disappears. That's true. Understood? So you try, okay, as how I said, you try it and try to listen the various sounds. Okay, first the procedure, okay, of palpatory, first find it out and then go for the auscultatory, okay, after confirming the systolic. Okay, and try to hear the various sounds. Okay, how does the sounds here, try to distinguish between the sounds. Okay, try. You come this side. Wants to go? You want to try? Describe and then do the procedure. First, what you'll do?
First, I have to place the cuff in her hand.
No, before that.
Make sure the patient's so before that, you have to adjust the level of this to the level of
Before that.
the patient is supposed to rest for 5 minutes.
Okay. And if she has taken some medications, or patient is in anxiety, okay, or has taken coffee, okay, caffeine, okay.
You have to ask the patient.
Okay. So that time you will have to relax her for 30 minutes at least. Okay. So after that.
After that, you have to place the cuff in her hand.
What will be the position? What should be the position of the hand?
Position of the hand, the wrist should be like this.
Flexed. And the arm should be
raised.
pronated. Pronated. Okay. Then what will be the direction of the cuff? Position of the cuff?
Above the cubital fossa, and this should lie towards the medial side.
And the tube should be directed inferiorly. No. See? Where is the
Cubital fossa.
first why I have described the cuff?
Here,
Why I have described the cuff? What are the things I have said about the cuff?
so you said it will be filled with air when it will rub.
To avoid the tissue resistance, what I said? 2 points I said, na? To avoid the tissue resistance. What I said?
Should be 20% more than the arm circumference, and the length should cover 2/3 part of
2/3 of the arm. Which part? Which part of the cuff?
So this is the length.
Which part of the cuff?
So the length will cover the circumference.
The bag. The rubber bag. Okay, where is the rubber bag?
So this.
See the rubber bag. You can feel it, na? See this. It starts from here. There is a stitch. See, it starts from here and it is ending here, na? So this part should be covering the arm, 2/3. So not this one. So first cover the arm with this part. Yes. Yes. And it should be, the position should be above the cubital fossa. And it should be not too tight or too loose. How will you understand? At least 2 fingers, okay? Is it? Okay. Now what you'll do? You guys can also practice. There are machines. Bring one from there. Hmm. Okay.
Sir, the hand should not rest anywhere.
It should be relaxed. It should be relaxed.
So
Okay.
the knees should be
Flexed. Like this. Now. Wait. Now.
First we have to set it to 0. It's already at
Okay. Okay. Now. Okay. Now. You have to tighten the valve. Otherwise, what will happen?
So in which
Yeah, it will
direction it's
deflate.
tightened? Like this.
Yes, this direction. Okay, if it is like this, then the clockwise direction is tightened. Okay,
clockwise.
and anti-clockwise it is.
Relaxed. So how much it should be tightened? Fully.
Not too much. Okay. It is tightened. Okay. Now what will you do?
Now we'll press it.
Before pressing,
Where the radial.
yes, find the radial pulse. Where is the radial pulse? Have you found it? What was the use of these 3 fingers?
So the first finger, the direction is wrong. Like this.
Okay, if you do it like this direction, what is the use?
The first finger is to trace the artery, the second finger is to feel the pulse, and the third finger is to block the ulnar pulse.
Ulnar pulse.
So the distal finger blocks the venous return. The proximal finger blocks the...
This finger is the proximal. Okay. This is the middle and this is the distal. What is the use of this one? To block the impulse. To block the impulse. Okay. This is to feel the pulse, and this is to block the backflow of blood.
Also back.
Okay. So did you find?
Yes.
Okay, it is pulsating. Okay, now raise the pressure.
Sir, up to
Till how much? How much you will raise?
180.
Till how much?
She cannot feel the pulse.
Yes.
Pulse is not
Okay, now deflate it. What should be the deflating pressure?
1 to 2%.
So this needs practice, okay?
So when deflating, you will be feeling the pulse. You will be feeling the pulses, the reading is also.
Yes. The pulse will guide you. Okay.
Sir, around 90.
90. Okay, fine. The next one come. You take the. You can come. You take the
So
machine.
you can change the subject. I think she's having trouble.
Okay, one more thing, okay? When you'll be putting the cuff on the patient, okay, for a long time, don't inflate it and keep it there. If you take too much time, what will happen? Flow of blood, and what will happen? There will be spasm, okay, and again you will get a wrong reading. Okay, you have to keep in mind that also, okay? Then do it in the other hand. Okay, you want to change? Okay, you come. Okay, come. Okay, anyone come? Okay, fine. You come next, okay? You guys, if you are not understanding, you can ask, okay? But do it properly, okay? Do it properly. And what about the cloth? You want to say anything about the cloth? Her cloth. No. What should be ideally?
Ideally, it should be like really upper.
Upper?
There shouldn't be any.
It shouldn't be anything.
if at all there is, you're supposed to fold it in
No.
such a way that it
It
doesn't.
shouldn't be folded at all.
No, it shouldn't be folded. Okay. Who is the patient? Okay.